Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. We are looking at the malnutrition universal screening tool, or in short, it is known as MUST, Malnutrition Universal Screening Tool. So to begin with, it is a 5-step screening tool to identify the adults. 5-step screening tool to identify the adults who are malnourished at risk of malnutrition or the undernutrition. Then what we see is it also includes the management guidelines which can be used to develop a care plan. So it is includes a management guidelines used to develop a care plan. Then comes the step 1, 2, 3. So what is step 1, 2, 3? So when you look at step 1, this includes the BMI scores that is greater than 20 means 0. So greater than 20 means 0, 18 to 18 point less than 18.5 is 2, and in between is going to be 1. So less than 18.5 will be 2. Then moving on with the step 2. Step 2 will be unplanned weight loss in past 3 to 6 months. So 3 to 6 months unplanned weight loss. This is what is going to be here. And if it is less than 5, it is 0. If it is 5 to 10, it is going to be 1. So 5 to 10 will be 1. And then when you look at greater than 10, it is going to be 2. Then will be third step will be to know the acute disease effect score. So as per the acute disease effect score, if the patient is acutely ill and there has been or is likely to have no nutritional intake for greater than 5 days, here the score is 2. Then moving on, the step 4 will be the overall risk of malnutrition. So you add scores. So here you add scores together to calculate the overall risk of malnutrition. And the scores will be 0, low risk, 1 for medium risk, and 2 for more high risk. So 1 means medium. So it increases as per the numbering. Next we move on to the step 5. So as per the step 5, there is a low risk routine clinical care. So 0 means low risk routine care. Clinical care, this is repeat screening and hospitalized weekly, and care homes are done monthly. Then comes the specific groups, that is example those with greater than 75. Next is 1. So when you look at 1, it is a medium risk observed. So document dietary intake for 3 days. After that, if it's inadequate, you have little concern and repeat the screening. So again, hospital will be weekly, care home will be at least monthly. And then every community at least 2 to 3 months. Next, moving on to, in case it's inadequate, you have clinical concerns following a local policy. You set goals, improve and increase the overall nutritional intake, and monitor and review the care plan regularly. Next, when you have 2 or more. So the 2 or more score, this is given in case of high risk. So you refer to the dietitian, nutritional support, as well as implement the local policies, you set goals, improve and increase the overall nutrition intake, and then monitor and review the care plan. And the care home monthly and community monthly. Unless a determined detrimental or no benefit is expected from the nutritional support, that is the imminent death. Next, there is a category of all risk categories. So in terms of all risk categories, you treat the underlying condition. So you treat the condition and provide the help and advice on food choice and eating and drinking when necessary. You record the malnutrition risk category, and then you record the need for special diets and follow the local policy. Then moving on to the obesity. Obesity, you record the presence of the obesity, and for all those with the underlying conditions. For all those with the underlying conditions, and then the underlying conditions. And to repeat obesity, you record the presence of obesity for all those with underlying conditions. These are generally controlled before the treatment of obesity. So this should be done before treatment of the obesity. To learn and grow daily like this, please do subscribe.